For the sake of time, I'm not going to make a long introduction. Michael Chopp is extremely well known. He's our first speaker. He won the Willis Award 2 years ago, and he has been a pioneer in basic research of stroke for many years. He's actually a physicist that is actually doing neuroscience research. So here it is, Michael Chopp.
Good morning. I think that's me. Let's see. It does work. So, you're trying to treat stroke, right? That's why we're all here and everything. But maybe we have to think about this a little differently. What you're doing is treating damage. You're treating the lesion. And we've made tremendous strides in treating the lesion. What are some of the strides? TPA, general thrombolysis, thrombectomies. But there are a pathetic number of patients who really benefit, stroke patients, who really benefit from this therapy to treat stroke. So I think really let's restructure how we think about treating not stroke, but the patient. If you look at your patients, the vast majority of patients show some improvement. And what we have not done adequately is to mine, to understand what the biological basis of this improvement is. So it could be that instead of treating the stroke, what we should do is to encourage restorative processes that are present throughout the body. And let me give you some background on that. So the reason your patients improve is that there's plasticity that is occurring, that's turned on. Well, I'll give you some insight why why that gets charged up after stroke. But essentially, what happens is there's an orchestration of recovery. What you have is an angiogenic process. You have vessels that are being generated, that are being extended, and these vessels are not simply passive tubes. What they are is little factories generating, we'll see a little while, very important molecules that then turn on the neurogenesis, or are highly coupled with the neurogenesis. Neurogenesis is the production of new cells in the brain that then work together with Toscanini. The angiogenesis and the neurogenesis induce plasticity, axonal extension, dendritic arborization. And so what you end up having is a constellation or symphony of recovery that occurs. So what we really should be doing is amplifying these processes. How do we turn them on? How do we make them stronger? Because most of the patients do not go back to the original basal state. So how do we get the patient to run a marathon? What we can do is to stimulate this type of recovery. And we've shown that we can take certain types of drugs, certain types of cell-based therapies, and amplify these processes. So what I want to tell you in the next few minutes is I'm going to give you insight into a very new technology, the body's own nanotechnology. And I'm going to tell you how cell-based therapies work and how the body uses these dinky little, what are called exosomes, these little pieces of bilipid layer molecules, that bilipid layer systems, vesicles, that contain genetic instructions that make all the difference in the world. And I'm going to leave you, I hope, with the ideas that we're at the beginning of a new understanding of disease and a new way to treat disease. So what we've done to move into the area of this exosome technology, and I'll give you some history on how we actually got to it. For years we've been doing cell-based therapies. And what we did was we take an animal, we give an animal a malignant stroke, we place let's say a clot at the origin of the middle cerebral artery, or we place a suture. I don't care how you create the stroke. Different strokes for different folks. And what happens then is that the animal has a deficit, right? If you're a classic standard neurologist and what you want to do is, okay, this animal has a clot, let's get the animal to the ER, ED, do an MRI on him and give him TPA. But, we decide to go on vacation, come back a week later and treat the animals. So what I want to do is not treat the stroke. What I want to do is treat the animal, enhance neurologic recovery. So we wait a week. These are also baby boomer animals. Wait a week, and we take these cells, and these cells, we've done it with bone marrow, umbilical cord, all these different types of cells. In this case, it's a mesenchymal cell, and we administer these cells intravenously. And what then happens is you get a remarkable recovery that occurs. And let's understand what's happening. And I'll give you one example of this of how we test for recovery. And we do a multitude of tests, of outcome tests on these animals. We treat these animals probably better than we treat patients, or more extensively. So what we have is the animal has somatosensory deficits. Normally animals, if you put a little sticky red tab on their paws, they can rip them off very, very quickly. If you take an animal and you give the animal a stroke, there's somatosensory dysfunction. You have to coordinate movement. It takes much longer to rip the tabs off. And what you could do is measure how long it takes to rip off the tabs as an index of somatosensory function. And what you see here is that 1 week later to these baby boomer animals, I can go and inject these cells, and these animals rip off the tabs. They're much better. And on all the equivalent NIH stroke scale and the footfall test, we'll go through that later. All the neurologic function, cognitive function, absence of depression, these animals really get much better. What is going on? What underlies this improvement in neurologic function? And what we show is that all this plasticity, you get the neurogenesis, the angiogenesis, the synaptogenesis, the biblical events that promote this neurologic recovery. Okay, so, but what do these cells do? What they don't do is replace tissue. What they do is that they talk. They talk. There's intercellular communication. And let's try to understand how the cells talk to other cells and dictate to them what to do and what to do properly. Turns out that essentially all living cells eject, create, send off these nanovesicles. And there are many different flavors of nanovesicles. I'm going to I'll focus on one type today. These nanovesicles are what are called exosomes. They range from 30 to around 120 nanometers. How big is that? 1/1000th of the thickness of my hair, which is quite thin. And so all cells send out exosomes. And contained with these exosomes, watch the switch, are a whole bunch of contents. They contain messenger RNAs, proteins, lipids, but also something called microRNAs. MicroRNAs are just these marvelous master switches regulating post-transcriptional generation of proteins. What really distinguishes us from lower species maybe is not only the genes that we have, but how we regulate the genes, the master regulators that we have. MicroRNAs are 22 nucleotides, really dinky little master switches that can simultaneously turn on and turn off multiple pathways. So these exosomes contain these master regulators. And what they then do, and I will show you what they do, is that these exosomes containing these microRNAs and proteins, I'm not excluding the possibility that there are other factors. There are actually six. We measured the numbers of proteins in these exosomes. They're like 700. It's miraculous. And many microRNAs. But what they then do is stimulate all this plasticity and induces neurological recovery. Okay. So let's go back to the stem cells. I gave you an example of restoring neurological function, right? I said you take MSCs, you inject MSCs, and what you have is remodeling, and these animals can rip off the little red tabs very quickly, and they really do much better. What is going on? Well, what is going on is these stem cells that I have are really ejecting, this is Texas, I could say, shooting off these little exosomes, and these exosomes are then being targeting parenchymal cells. These exosomes, by targeting parenchymal cells, neurons, astrocytes, microglia, endothelial cells, all your buddies, they then turn on and they regulate gene transcription and translation and do a lot of stuff. In addition to that, which may be another talk, when these exosomes from the stem cells are absorbed by the parenchymal cells themselves may set up like a chain reaction and produce other exosomes. That's fascinating. Again, I used to be a physicist, so I'm really turned on by chain reactions and nanoparticles and stuff like that. Okay, so the question is, what would you do now? I've given you this background. I've told you that what stem cells do is that they eject these little particles that get absorbed, and then that transforms the entire parenchymal environment. Actually, it also transforms everything in the body. We may get into that if they don't throw me off stage. Okay, so what you should do or consider doing is saying, you know, who needs cells? Who needs cells? Simply harvest the nanoparticles, these nano containers that are coming, that are emerging from these cells. So let me sell the cells to somebody. Let me simply go to my kitchen, harvest the exosomes, and let me treat neurologic disease and injury with these cells. And I know stem cells are good. Oh, you have to know where to buy them. You have to get them. You have to get the good ones. But if you have a healthy young MSC or umbilical cord or a iPS cell, you can harvest the stem cells and donate the cells and use the cells to treat, and they'll do good stuff. So what we initially did was to give our animal this malignant stroke. Right? We take an animal, and I think I have the same little red tab test up there, and say, okay, Let me treat simply with the exosomes. And I do this intravenously. I administer the exosomes intravenously, and what we see is we also get quite a remarkable therapeutic benefit. That these animals can functionally, cognitively, it's significantly improved. This improvement persists. And when I do look at plasticity, the neurogenesis and the axonal remodeling and the white matter remodeling, the number of oligodendrocyte progenitor cells, everything is there's a confluence, there's a symphony of recovery that is mediated, that is stimulated by these exosomes. Okay, so not all your patients are rats. So what we have to do is go a little further. And we had some wonderful collaboration with Tara Moore and the group at Boston University. And what we decided to do is to say, let's test this stuff out in monkeys. And what Tara and group do, which is, and she's in the audience, is they have for many years perfected a monkey model of a cortical lesion. And they map it, they know exactly, and what monkeys like doing, they like eating M&Ms, right? And what you do, the monkeys are trained to use beautiful, great dexterity, pick up the little M&M from a dish and eat it, right? You give this animal this cortical lesion, give the animal, it's very well prescribed, give the animal a cortical lesion, and the animal really never gets back to its ability to use its fine motor movement to pick up the M&Ms. Okay? So, however, if you treat these animals, these monkeys, with exosomes, these are exosomes from mesenchymal cells from the monkey, you actually get all these animals recover. And instead of over time compensating to pick up the little M&M, they can use their fine motor. And I believe the group at Boston really has never seen this type of recovery before. And this is a highly restorative therapy. And it gives us tremendous hope that we can move this into the clinic. Okay. Now, our job is to improve on nature, to use nature, to capitalize on nature, to use the body's exosomes and nanovesicles from many different systems. But look, can we improve on what we're doing with these exosomes? Not just simply taking exosomes from iPS cells or mesenchymal cells or umbilical cord blood cells. Can we do something better? Remember I told you before my passion about my dinky microRNAs, that they have so many effects. They could simultaneously turn on and turn off many different pathways. So what we thought is maybe what we can do, I'm finishing, maybe what we can do is to alter the content of the exosome. How do you alter the content of the exosome? Let's say you have a kid. You want to have a good kid, you have to have a good parent. So what you do is you go to the parent, insert the gene, the plasmid for a particular microRNA in the parent. You then produce exosomes with an enriched microRNA. And we, for multiple reasons, we've done it with many different microRNAs. I'm just going to give you an example with one particular microRNA, a miR-133b, and the reason we selected 133b is because we've shown that the target genes, the target molecules, messenger RNA of the 133b it blocks evil molecules like Rho and RAC. It turns down molecules that inhibit axonal growth. That's why we selected it. And what we find, remarkably, is that if you treat these animals with exosomes, they do much better. If you treat the animals with exosomes that have been enriched, tailored, whatever you want to call it, engineered with microRNAs, that greatly amplifies neurologic improvement. Okay, so where are we in the future, and what do we want to do with this? I think what I've told you is, first I castigated neurology. I said, it's great, you're doing wonderful work, you got to treat the lesion, but there's more, there's the body. And the body has its own magnificent need and processes that are activated after an injury to turn on restorative processes. And I demonstrate to you that there are restorative processes. We can amplify these restorative processes, and what underlies mechanistically, what turns on this plasticity, angiogenesis, neurogenesis, and all that, are really these exosomes, these nanoparticles that are emitted from many cells. We've taken them from stem cells. This opens up, and then we can tailor the content. We could create designer exosomes to tailor the content of those exosomes with specific microRNAs to turn on programs and pathways that we want to. This opens up, I think, the future in nanotechnology. What you have to do is think very small, and you could create and you could treat big. It gives us also fundamental insight into disease. We have to realize that a lot of disease has to do with intercellular communication. And the brain talks to the heart, and I'm not talking about yourself talking on your iPhones. If we understand intercellular communication via these little exosomes particle, we'll learn how to, we'll get to the basis of a lot of disease, and more importantly, we'll be able to treat injury and disease, and I think that's the future. Thank you.